A lot of my clients ask me, Dr. Lauren, how often should I come to PT? Y'all, that really is the $1,000,000 question. But truly, it depends. I had 2 different clients this week and I want to talk about the differences and why I chose different plans of care, different frequency and timeline of physical therapy. The first client I evaluated was a fresh rotator cuff repair. When I think about healing timelines, I have to think about what kind of tissue are we dealing with. A rotator cuff repair is a tendon. Tendons have a poor blood supply, which directly affects healing timelines, slows it down. We also have to think about when you get surgery, there's multiple soft tissue injuries involved, different healing rates of all these different tissues, plus surgical precautions, movement restrictions that we also have to wait on. We're going to be working together for probably 6 months, starting out twice a week, getting pain under control. We may drop to once a week for a short stint. And when we're able to start strengthening and return to sport, we might beef that up to 3 times a week. So for him, a 36 visit package makes sense given the healing timelines, where he is now, and where he would like to be goal-wise. The second client I evaluated was a soccer player with a hip flexor strain. When we think about a strain, we're talking about muscles. Muscles have really great blood supply, which means their timeline is going to be much faster. We're also not dealing with surgery, so no multiple tissues with different healing timelines, no surgical precautions. Our goal is basically to get him pain-free, modify how he's moving to make him safe, keep him in his sport if we can, and get him back to full contact soccer without pain. Given that and those healing timelines, I recommended 12 visits over the course of 2 to 3 months. I like to start with twice a week just to get them out of pain, get that under control, and then drop to once a week so that I can gradually return them back to full contact sport and evaluate how he's doing. So when my clients ask, how often do I need to come to PT? I'm thinking through a lot of things in my head that have to do with what is the type of tissue that we're dealing with? Does it have a good blood supply? Was there surgery? Do you have precautions? Where are you now? Where were you before? And where do you want to be? Lots of things that play into it. Most importantly, we need to remember that rehab is just training in the presence of injury. We want to keep you safe, but we want to keep you an athlete for life.